Delmarva Today with Don Rush.
Coastal Hospice is entering a new era with a changing of the guard. Welcome to Delmarva Today. This is Don Rush. Alane Capen, who has served the organization for some 16 years, is stepping down this month. And during her time, there have been many changes, including a partnership with Tidal Health that provides palliative care to patients in their homes. Stepping up to the job is Monica Escalante. She would be the first Latina to fill the role and has been described by one local official as, quote, having a hospice heart. Well, we have both of them in the studio this morning. Welcome to the program.
Thank you. Glad to be here.
So, Alane, let me just turn to you first of all. What has your 16 years been like here, and what kind of changes have you seen over that period?
Wow, my 16 years has been an incredible honor, for one thing. This community, I have a hospice experience elsewhere. I came with experience behind me, but this community is one of the most involved and generous communities that I've seen. And I feel really honored to have worked with the people that I've worked with and the boards and just the community of donors as well. So what
has struck you particularly about this community, particularly in contrast to maybe the other areas that you worked in? Its needs, its culture. What has struck you over the time that you've learned about this area?
Well, it is a varied community. When you go from one county to the other, and even within a county, there are many differences. But the sense of community, I came from Dallas where you don't have that tight-knit feeling, but people really want to take care of each other, whether that is through the work they do or through the donations they're able to give or their volunteer time. People are really invested in seeing the hospice be successful, and I think that's different here.
So what kind of programs have you instituted in over the last 16 years or so? What makes you the proudest, I guess?
Well, so programs that have instituted, I need to give Marion Keenan a little, she's my predecessor who actually started the Tidal Health Partnership in its infancy, but the growth of that program is one of the things that I'm very proud of. Creation of the Stansel House that took many years, and that is our residence that's in the Ocean Pines community. That is one of the big lifts that we have accomplished, and I say we because it's during my time, but it's because of the engaged board and the donors and the staff people that supported it as well.
So what kind of services are they providing that perhaps weren't there before?
So Stansel House is a residential facility. We have Coastal Hospice at the Lake here in Salisbury, which is kind of like a hospital for hospice patients. You have to have certain symptoms out of control or Medicare criteria to be there because it really is run like a hospital with a doctor there daily. The Stansel House is residential. So for people who are otherwise, if they take their medications and they get food and get their hygiene needs cared for, would be okay, but they're maybe elderly and living with an elderly caregiver. They don't have a safe situation at home. So Stansel House provides that safety, the 24/7 eyes on, help with simple things like getting your meals, taking your pills on time, getting to the bathroom, all those things that become very difficult when you're, seriously ill.
You also have a partnership with Tidal Health. Tell me a little bit about that, and because I guess because it gets really into the homes rather than somebody having to go somewhere, I guess it is.
Well, with Tidal Health, so hospice goes into the homes.
Right.
90% of what we do is in patients' homes, and a little bit is at the lake, and a little bit is at Stansel House. The palliative care partnership that we have, we do visits within the hospital. We help do consultations for palliative care within the hospital, but we also run clinics both in Salisbury and in Ocean Pines for people who are not ready for hospice yet, but they still have a serious illness and they need symptoms addressed. And so they can be at home with their loved ones and then be coming into the clinic to receive care, order changes, recommendations. They can get, some of those other needs attended to in our clinics.
So, this is one of the things that struck me is that this area, we talk about the grain of the shore. That is that there are a lot of retirees who come to the shore, and obviously I would assume that they would also mean an increase in a number of people who eventually will utilize your services. What kind of changes have you seen along those lines?
So I think just the growth in hospice overall, our largest segment of patients are over 85, actually, and certainly the over 65 is the largest portion. Although we do care for younger people and even children, but we have just seen enormous growth, and I think that is because of the graying of the population, and with more people coming into Worcester County and Wicomico County, we are able to reach more people. And I think that's been one of the big successes, is that we're actually meeting the needs of people that are here more effectively and better.
So what is it like then for a family to have to face the fact that, one, that their loved one is going to die, and two, engaging in hospice? I mean, what emotionally is that like that you've seen?
Wow, that's as different as families are. So, for everybody, it is a crisis time. Nobody wants to hear the news that it's time to come to hospice. Unfortunately, a lot of people and a lot of physicians delay that decision, and so they don't get the best benefit they could. But we are equipped with a whole interdisciplinary team that can address all of those emotional issues. Our social workers will help deal with things like, how do you talk to the children or the grandchildren? Or, is it a life goal to mend the relationship with your brother that you fell out with years ago? We deal with all of those things, as well as some of the spiritual questions. And it's not strictly religious, but it might be, did my life have meaning? I'm questioning whether there is a God, and to have somebody who's skilled at having those conversations. And then, of course, our volunteers are emotional support people, too. And they're very important because they're not there for a specific chore. They're there to be your friend and to create a friendship with the patient or with the family member, to be able to provide an additional layer of support, give the family member a break. They can sit with a patient, and for a patient, they can provide distraction. They'll take the time to look through those photo albums with a patient, play a game of cards, read a book.
How important is that, by the way, in terms of respite? Because a lot of people are now, and certainly my age, I went through this, where you basically cared for your elderly parents. Sometimes takes up a lot of time. Some people quit their jobs. What is it like for at least to be able to get that break from that constant demand that, you care about this person? On the other hand, it does seem stressful.
So Medicare and Medicaid and most insurance allow for what is called respite. You said the word. And it was the recognition that this is hard work, that, people want to be in their own home and families want to be providing care, but it is very hard work and people need a break sometimes. And so there is a respite benefit for 5 days, but you can use it repeatedly. And it's been very important for some folks. It can give you time to recharge your batteries, do something for yourself, do self-care, go play a round of golf, and get away from the seriousness of that illness for a little bit, and know that your loved one is being cared for at Coastal Hospice at the Lake or at one of our contracted nursing facilities for that time period. And it's very important. People need to recharge batteries. You can't work all the time every day. You've got to take breaks from it once in a while.
You mentioned a moment ago about volunteers. What is that experience like for someone to come in and volunteer? I mean, what are generally is their background when they want to do it? But it still has got to be a life-changing experience for anyone who volunteers in that kind of situation.
So we have volunteers for all kinds of needs. We've got somebody who used to be an editor for Reuters who comes in and helps us do office work. So, but then we have people who either some of them have just been family members in the past. Some of them have no experience. Some of them are retired nurses, and they want to still contribute to the community and make that connection with people. And so they want to help and be a patient care volunteer. And we put them through 18 hours of training before they go out into the homes. And we provide a lot of support through our volunteer department so that, they feel supported and not like they're on their own.
So you've been there a long time. Is there any particular situation that comes to mind that is perhaps emotionally significant to you, or that you recall? I mean, I'm not trying to get into names particularly, but a moment where maybe perhaps it said that all this work was really important?
There are many of them. Wow.
Any particular one or two? Or
So let me think of a couple. And I'm trying to think of ones that I haven't talked about recently.
It's okay.
So there are some moments with children. We had one young woman who knew that she was going to pass away before she would ever go to a prom or anything, and we helped the family to create a prom experience for her. And the family did a lot of that. But we had, with our thrift shop, we brought gowns for her to try. So everybody was going to have this big dressy dinner at her house. And just being able to help with something like that was really emotional for the team to be able to make that come true. I think that, we had another woman quite a while ago who was an artist, and she wanted to have an art exhibit. That had always been her desire. And we actually set up the garden room at Coastal Hospice at the lake with all of her paintings all around it, and her family made prints. And she was well enough that she was able to sit there with her oxygen on. We held an open house, and so we had people from the outside coming in, and she had her art exhibit and she signed prints for people. And I think those are the kinds of memories that if we know what somebody's goal is and we can help them try to meet that goal, those are really emotionally rewarding. One of Monica's first experiences here, she went out with a chaplain, and they pulled together a really quick wedding because the daughter knew her mother wasn't going to live to see her wedding. So they really quickly got a license, got our pastor to do it, and pulled off the wedding in one day's notice time so that her mother could be present for her wedding. And even though I wasn't there, Monica was, the stories of hearing that tears me up because I know how important that is to people.
Well, Monica, you were there. Tell me a little bit about that experience. That it must have been certainly emotional and something to be remembered.
Well, I am blown away with the kind of care that Coastal Hospice provides. I've been in the industry for 2 decades, and I've seen many hospices around the nation. And I always knew that Coastal had a very good reputation. But anything I imagined was to a point. Totally, the care that is provided in this region is just outstanding. We were just reviewing the statistics of the surveys that families get after we serve them, and we are above the national average in every category, and certainly above the stage average in every category. So I'm just bringing that back to the wedding that was organized in one day. That's just testimony to the teamwork of the staff. Mm-hmm. It was a collaboration between the nurse, the chaplain, the family, and the spiritual counselor that officiated the wedding. It was absolutely amazing. And this was a very humble neighborhood. And with very humble means was organized something as meaningful as this. I volunteered to be the photographer in the ceremony and have the wonderful memories of at least supporting this effort in that way. And most moving situation for me, I felt I am landing in the right place for a community that comes together to support their own. And that's what I see in the staff. Sort of we serve, for instance, Somerset County, and we have residents, nurses that live in the county, that know the families that have lived in those areas for generations. So this is not another patient like it would be in another part of the country. This is someone they know, a family they have seen for generations. So they go above and beyond in every way. And that, to me, is the biggest blessing we have in the Eastern Shore.
So you come from, I think, as you said, Montgomery County.
Yes.
So how does that experience contrast to what you're at least initially seeing here, and what was that experience like?
Well, it's very different because in Montgomery County, there's less attachment to the region, actually. Although there's rivalry among counties, there's less attachment to the region because there's a transient situation. Whereas here, there are deep roots. People talk about neighbors coming with food as soon as they hear about the diagnosis, or families needing support and not needing to reach out to their faith community necessarily, but it might be there, but it's in addition to the neighbors, the friends that come together. And then many people that I have met in the last month or so have moved here and have now roots here because they want to be part of a community that is active, that is supportive of the members of the community. And I want to feel that. I sort of already feel that too. And I sort of made this decision to come to this region because COVID made me aware that I really didn't have that kind of support in Montgomery County. And when Alane decided to retire, I thought this will be a once-in-a-lifetime opportunity to actually come to a region that I loved vacationing. But now I'm a member of it, and I feel I'm detoxifying. If I can summarize how I'm feeling about the transition, I'm detoxifying and feeling that I have better quality of life here.
And she mentioned a moment ago about COVID. What kind of impact have you seen in terms of COVID, in terms of obviously the end of life? Have you guys been as necessarily involved in that? I know towards the end.
We have.
Yeah, go ahead.
We have, yeah. So we've been impacted in a lot of ways. We have served patients that have had COVID. We have seen patients coming to us very short time. People are afraid of getting health care. And so not just the COVID patients, but patients overall have been delaying health care. And so we tend to get them for a shorter period of time. And even though we have been very busy and seen as many, if not more people, we're having them for a very short period of time. We also were able to maintain a safe visiting structure at Stansel House. So we had people who wanted to come to Stansel House because they could still have a couple of visitors when the nursing homes closed down on that. And our partnership with Deer's Head has been wonderful because they completely respect that we are end-of-life care there. And so even when Deer's Head was locked down to visitors, they were allowing one visitor at a time for the coastal hospice patients. So, I have to give them kudos for allowing us to still, it's so important to not be separated from your loved ones when you are dying. And, that became a real crisis in this community and everywhere in the nation during COVID because people were separated from the ones they loved at the worst time of life ever. So we've been able to continue visiting. Of course, being in patients' homes, we never stopped. We decreased the number of visits in the home, but we never stopped doing home visits. So our nurses continued to go out in the home. Our aides continued to go out in the home. Chaplains and social work moderated what they were doing so that they would do an assessment and meet the family in the home, but then they would go back to telephone support if they felt that they were able to and didn't need to be there in person. So we tried to minimize the comings and goings into people's own homes, but we maintained that personal touch, that personal face-to-face interaction because there's no time of life that's more important for that. Been very hard during COVID.
What kind of precautions did you take in terms of the people that you are that are going out to serve, as it were? Did they wear, protective gear? What was the protocol there?
So one of the things we would do is we would screen the families by telephone before every visit, and the typical questions you've all been asked everywhere, have you been exposed to anyone with COVID? Have you had a fever? We would do all of that before we went. But then, of course, we would always wear a mask. We were requesting that our family members wear masks when we were there. And, of course, if we knew that somebody had come from the hospital, say, where we thought that was a high-risk situation, or if we knew that they had COVID, then we were in full protective gear with an N95 and a gown and a face shield and doing all of that. And, of course, our units operated that way as well.
Touchy question, but did you encounter people who didn't want to wear masks? And I'm not talking about the person who's dying necessarily, but just the family members alone. I mean, and how do you deal with that? Because there is that trend out there.
There is that trend out there. I will say that people are people want the help that we bring, and so but we gave people the choice of if you don't want the mask, step out of the room while we're there. And so they still had the choice to either just sort of separate themselves from us or wear the mask. You know, if you want to hear and be at the bedside with us, please put a mask on. And most people are accommodating.
So how responsive do you think that, for instance, the federal government has been in all of this? I know there's supposed to be some bipartisan legislation, I think, on the Hill to increase funding for palliative care. What's the situation with
for
that?
For palliative care, well, we are hopeful that Medicare is going to come up with a payment system that would allow for home visiting and palliative care. So palliative care, it really has a reach beyond hospice care. You don't have to be limited by that 6-month prognosis, and you can have palliative care while you are pursuing aggressive disease-curing treatment. They have shown that it overall reduces costs on the healthcare system by minimizing unnecessary emergency room visits, minimizing unnecessary hospitalizations. And so it really would benefit the government and the Medicare system to create a pay source that would reward us for doing that. There isn't one now. So, you know, we do it by getting paid a reimbursement for a physician visit or a nurse practitioner visit. But you spend a whole lot more when you are traveling out to a patient's home. You're spending an hour with the family, you know, and you get reimbursed $72.50 for it, you know, something like that. So
right.
they're talking about different models, including a, you know, per member per month kind of thing. Medicare explored a Medicare Care Choices model that had a lot of restrictive requirements to it. And paid very little, and we actually participated for a couple of years and then opted out. So we're hopeful that they come up with something that works better than that model, but they're looking.
But
they're looking.
One part that is a benefit that Medicare is paying for palliative telehealth, so palliative virtual consults. Mm-hmm. So for all those people that cannot get to the offices that we have in partnership with Tidal Health, they can still get a visit on their phone with whatever app we have at the moment and see a palliative care physician.
And that became very important during COVID because the clinics, you know, people did not want to come into the hospital to go to an outpatient clinic for the most part. Mm. So that telehealth was very important.
So what was it like for you folks in Montgomery County? I mean, you encountered the same issues, and what was that like?
Absolutely. The same issues everywhere. Main goal is to protect our patients, right? Sort of PPE was scarce at one point, and I remember the community came together and we got donations from the Chinese churches with some PPE they had left over. I mean, at Coastal, we just got a big donation also of N95s. It was hard to find places to buy the PPE. I had to smuggle some PPE from really everywhere that you can find. There were people that wanted to be paid with PayPal and not really have a check because I don't know how that PPE was procured. But we found a way to protect our patients and our staff.
And our staff, yeah.
Also, another important component here is the testing, right? We, for all those who are not vaccinated, we practice regular testing. And that's another way to restrict the spreading of this virus. Yeah. And we, at Coastal, we have a full supply of rapid tests.
We got a load of donations through, actually through the Department of Homeland Security, and then it came through emergency management, the last shipment that we got of rapid tests. So we were even rapid testing our visitors to Stansel House and routinely testing our staff and patients there.
Now that we have a set of vaccines, has that changed the situation for you guys, or what?
It did for a month or two.
Only for a month or two?
Well, now we seem to be escalating back up, don't we? And you know, I'm aware that in this community, you know, We have some breakthrough infections for people who are vaccinated. This Delta variant is spreading between vaccinated and unvaccinated people. If you are vaccinated, your chance of becoming ill or seriously ill is much, much less. So definitely a benefit to get vaccinated. But we are seeing our positivity rate escalate, and we are just had meetings this week. We are reinstituting all of the policies that we had regarding testing, masking, using N95s and face shields that we had during the height of COVID. We were able to relax it for a couple of months, and now we're going back. And now to enter any one of our buildings, even the office buildings, you are going to need to be masked in order to enter.
I wanted to turn to you, Monica, because we have a growing Hispanic community here. We certainly have it in Delaware, but it's also here on the Maryland Eastern Shore. What kind of issues does the Hispanic community face in terms of end-of-life care? And I mean, how many people are taking advantage of this? What's the situation? What sense do you get?
Well, it's certainly a benefit that is underutilized. It's underutilized across the board. There's not one community that uses it well. Actually, there's many caregivers, as I'm hearing Alane talk about the Eastern Shore, that have been caring for a loved one. And this is a husband caring for a wife, or a wife caring for a husband, that have delayed going to the doctors and so forth. They are not as aware of our services as they can be. I have never heard any family across the board say, I signed up for hospice too early. It's quite the opposite. And it's a benefit that is for at least 6 months, right? And many people only take advantage of these for a short period of time. And certainly the majority of our patients take advantage of it for a week or so. And when it comes to the Latino community, the Hispanic community, that's even worse, right? Because the term hospice, translated to Spanish, means hospicio. And hospicio is a place where you go and leave your loved one for long periods of time. And those places have bad reputations because they are not the best in Latin America or Central America. So that connotation of hospicio, if you say to a Spanish-speaking person, this is hospicio, immediately they're like, I should run away from this and find something else. So we try to use hospice, the word in English, just to move away from that connection with the translation. And certainly is underutilized, just like African Americans underutilize it as well. So we hope at Coastal to do more education in this regard. Every community is different. Even within a family, if you're trying to talk about the end-of-life wishes, everybody has a different opinion. Imagine with people that have different heritage, it's even more diverse. So I really hope to get involved with the Latino community here. I was very involved with the Latino community in Montgomery County. We had a big effort to vaccinate the community, and actually in Montgomery County, the Latino efforts, the Latino Health Initiative efforts were so successful that we actually turned what at one point was a health disparity with having the lowest percentage of vaccinated over 40, over 30 population. We turned it into the highest. So it became that the most vaccinated population of all. So how that was attained, it was a collective effort, sort of the community came together. It's a grassroots. I think that's the best way to spread the word. And one person trusting the healthcare can talk to another one, talk them into trusting healthcare as well. I don't know if I responded to your question or took you in a different direction.
Well, I'll tell you, we'll end it on that. We've been speaking with Alane Capen. She is stepping down as head of Coastal Hospice, and Monica Escalante is moving into the job, and we appreciate you both stopping by, and we wish you, Monica, a good luck and good endeavors. By the way, quickly, do you have any idea where you're going to be going, Alane?
I'm staying right here on the Eastern Shore. I'm going to ride my horses, and I'm thinking about volunteering.
Well, there you go. See, you got an extra volunteer right there, right? This has been Delmarva Today. I'm Don Rush. Thanks for listening.
Delmarva Today with Don Rush.